So Dr. Atkins, the American Heartworm Society has established some very specific guidelines about the therapy for heartworm disease in dogs. Can you elaborate a little bit on the recommendations?
Yes, the Heartworm Society recommends that the dog be diagnosed with heartworms and at that time started on a preventive. And the idea there is to prevent further infection and actually start to reduce numbers of microfilariae. Also at that time, the dogs are placed on doxycycline at 10 milligrams per kilogram twice daily, and that is taken for 30 days. After that, the dogs are given melarsamine, a single dosage at 2.5 milligrams per kilogram, and are rested, and I'll just emphasize the dogs are rested, cage rested, kept indoors, leash walked, for 30 to 45 days, depending on preference. And then the process is repeated in which melarsamine at 2.5 milligrams per kilogram is given on the first day and then repeated on the second day out at that point. Again, the dog has to be rested for that time. The macrocyclic lactone is given continuously then from the time of diagnosis, and ideally given every month or every 6 months if it's injectable for the rest of the life of the dog.
So Dr. Atkins, the guidelines have evolved over time. Can you give a little bit of insight into the rationale about how we got to where we are in the guidelines as they stand?
Mm-hmm. The use of the macrocyclic lactone from the time of diagnosis is simply to cover these dogs who may be receiving continued exposure, depending on the time of the year, to mosquitoes carrying heartworms. And so you get them on preventive at that time and hopefully prevent further infection. Also, macrocyclic lactones will reduce microfilarial numbers, and we certainly believe that's important to prevent spread of the disease, and also we worry about resistance. And so the doxycycline was added for a couple of reasons. Maybe most importantly is to reduce the adverse reaction to dying worms by destroying the reproductive system and GI tract of these parasites. So when they die in the pulmonary vasculature, they release less detritus and proteins and antigens that may cause a significant adverse reaction. The other really important part about the doxycycline is it drives the numbers of microfilaria down much more quickly and to much lower numbers. And so this has been a concern that if we continue to give macrocyclic lactones to dogs who have microfilaria, we may then be selecting for those that are the least susceptible to macrocyclic lactones, and that they may then contribute to the concerns about resistance.